Good morning and welcome to this formal meeting of the Public Protection Community Scrutiny Committee. I'm Councillor Nigel Pepper, Chairman of this committee. Streaming arrangements, can I remind you that the audio-visual feed of this formal public meeting is being broadcasted live via the County Council's website. And with this in mind, I would like to welcome members of the public watching this live. As the meeting is being streamed in the usual way, I'd like to remind you all that your comments will remain accessible online and can be reported by the media. Regarding health and safety, I'd just like to begin with a health and safety announcement. There is no fire drill planned this morning. In the event of the fire alarm sounding, we need to leave the council chamber through the rear doors and leave the building through the reception into the front car park and wait there for further instructions. Meeting etiquette. Can I remind everyone to ensure their mobiles, laptops and iPads are on silent for the duration of this meeting, please. Also, may I remind you that the hearing loop is now activated. Request to speak will be collated by the scrutiny officer, Chiara. When invited to speak, you should press the button on your microphone unit to make it live, then press again when you finish your contribution. We'll now move on to the formal agenda. Agenda item 1 is apologies for absence, replacement councillors. Trina, I'm going to turn to you for that one.
Thank you, Chairman. We've received apologies for absence from Councillor Gray, Councillor Stokes and Councillor Mrs Austin. Thank you, Chairman.
And we have no replacements for those?
No replacements.
Okay, thank you. Item 2 on the agenda is declarations of councillors' interest. Do any members wish to declare any interest, please? Councillor Key.
Yes, thank you, Chairman. Could I just ask it to be noted that under item 5, the antisocial behaviour community trigger, my wife is an antisocial behaviour officer at one of the district councils in Lincolnshire. Thank you.
Okay, thank you. So just for the record, we'll reflect that Councillor Key has declared an interest in relation to agenda item 5. Thank you. No others? Thank you. Item 3, which is the minutes of the previous meeting, which was held on the 20th of June 2023. This item is to approve and sign the minutes of the last meeting as a correct record. Previous meeting minutes can be found on pages 7 to 16 of the agenda pack. I'm going to take it that you've read those. Do I have a proposer and seconder for those, please? Councillor Mr Clark. Seconder, Councillor Sneath. Thank you. All those in favour, please raise your hand. Those against? Any abstentions? Councillor Key and myself. I wasn't here at that meeting. Okay, thank you. Those minutes are agreed as a correct and accurate record. Thank you. We'll turn to item 4, announcements by the Chairman, Executive Councillors and Lead Officers. It goes without saying today we have a busy agenda. Therefore, may I remind members that your line of questioning should be relevant and add value to the debate, and therefore I ask that questions and contributions are succinct. Officers and external presenters are also reminded to take their reports as read by committee members and only summarise key points and what support and input is required by this committee. In relation to item 12, which is the last item of today's agenda, in line with paragraph 3 of part 1 of schedule 12A of the Local Government Act 1972, the report will be considered offline due to commercial sensitivities arising from its contents. I'd like to take this opportunity to congratulate Paul Smith, I can see it in the chamber today, on his appointment into His Majesty's Senior Coroner for the Lincolnshire role, a well-deserved and long-anticipated appointment, and to wish him on behalf of all committee members a good and long tenure. Thank you, Paul. Finally, with my announcements, I believe this to be Chiara's last meeting as Scrutiny Officer for this Public Protection Committee. I clearly remember introducing her for the first time, and I got in a pickle and tongue-tied pronouncing her surname. I've just introduced her by first name since, because I didn't want the embarrassment. So I'd like to thank you, Chiara Haji-Owanu, for your excellent contributions to this committee. Thank you.
Mr. Chairman, it's been a pleasure.
I'll now move on to Executive Council announcements. Councillor Woolley, have we got any others with us? Lindsay, yeah. Councillor Lindsay Corringham. Okay. And no one online? No one online? No executives online. Okay. Okay, thank you. Senior officers announcement. Finally, are there any announcements by senior officers, please? Martin.
Thank you, Mr. Chairman. This is in relation to the coronial merger bid for North and North East Lincolnshire. Apologies that I've not been able to put a paper in relation to this, but on the 17th of July, the Ministry of Justice formally published the business case that sets out the merger for what we are looking for within Lincolnshire of the Greater Lincolnshire Coronial Service. There are two competing bids in relation to this, which I'm sure the Chamber is aware of. So there are two options that are presented within the business case, one of those being a merger between Lincolnshire North and North East Lincolnshire to create the Greater Lincolnshire Coronial Area, and then also a second bid that is between North and North East Lincolnshire, combining with East Riding and Hull Coronial Area to make a Humberside Coronial Area. This has currently gone out for consultation. The reason why I'm making it as an announcement today is for your information, because actually the consultation period closes on the 16th of August and we wouldn't have a scrutiny committee prior to that. So it's very much for your information. Now, the consultees that sit within Lincolnshire are our local MPs, obviously our leader of the leaders of the council. We're represented also by our Executive Council leader, Councillor Woolley, and also Councillor Matthews. It also goes out to the funeral directors, pathologists, police, health, as a wide expectation. I'll be writing to all those consultees in relation to encouraging them to make sure they return their bids into the MOJ, probably setting out three areas of business that sort of set our case. One is that our bid kind of formalises the ambition around the Greater Lincolnshire kind of mayoral future of Lincolnshire and our three unitary authorities. Also the fact that we've got full support from North and North East Lincolnshire to join Lincolnshire County Council in terms of providing the services of the coronial area. And also I think some of our performance trajectory, which Mr Smith will come on to within his paper, is probably trajectory in the right area where we can support North and North East Lincolnshire. Thank you, Chairman.
Okay, thank you, Martin. Any other senior officer announcements, please? No? Okay, thank you. We'll now move on to our formal agenda. We'll first sit as the Crime and Disorder Scrutiny Committee by exception today, as this was requested by members at our last meeting. The Crime and Disorder Committee, established under Section 19 of the Crime and Justice Act 2006, to review and scrutinise decisions made or other actions taken in connection with the discharge by the County Council of its crime and disorder functions. So agenda item 5 is the Antisocial Behaviour Community Trigger. This report is on pages 17 to 24 of the agenda pack and provides information on the Antisocial Behaviour Community Trigger and the county-wide process established in Lincolnshire by the Safer Lincolnshire Partnership Antisocial Behaviour Core Priority Group, which comprises of a wide range of organisations, all of which have a responsibility to respond to antisocial behaviour, either through enforcement or in relation to providing support services. This topic area comes at the specific request of committee members. I believe it was Councillor Mrs Clark who requested this to come to this committee. Our actions are to review and comment on the detail of the contents of this report, endorse the report and commit their support in helping Safer Lincolnshire Partnership raise awareness of the community trigger and how it can support victims of persistent antisocial behaviour throughout Lincolnshire. Also, the request is that a follow-up report be submitted in the next year, providing updates and progress against set targets and actions, as these are set out within the Safer Lincolnshire Partnership Delivery Plan. The report will be presented by Lisa Merriman, Community Safety Strategy Coordinator of the Safer Communities Partnership. Over to you, Lisa.
Thank you very much, Chairman. So my report today aims to improve understanding around the community trigger and its effective tool to support victims of persistent antisocial behaviour. As already noted, I won't cover the full report, but just wanted to cover some key points. So the Antisocial Behaviour Core Priority Group is responsible for ensuring any statutory duties are met, and this includes the community trigger, which was introduced through the Antisocial Behaviour Crime and Policing Act 2014. The community trigger gives victims and communities the right to request a review of their antisocial behaviour case where a local threshold is met. The Antisocial Behaviour Core Priority Group is responsible for setting that threshold and has chosen to follow a national model. A request can be made by an individual victim, a business, or a community group. The process brings agencies together to take a joined-up problem-solving approach to find a solution for the victim. This involves reviewing what actions have already been taken to address the problem and then consider whether anything more can be done. This includes looking at both informal and formal antisocial behaviour powers and tools, as well as any support measures put in place. Antisocial behaviour can be very subjective and complex at times, so it's not always possible to reach a solution. So the community trigger can be used to help victims fully understand what can and can't be done. So whilst it may not always be possible to solve the problem, they can be assured that everything possible has been done to try and tackle it. It's important that victims feel that they have been listened to and that their complaint has been taken seriously, even if it is not the result they wanted. Each victim has the right to appeal. So if they are dissatisfied with the way in which the community trigger case review has been carried out or the decision on whether the threshold has been met. So this appeal is carried out by the District Council Community Safety Manager, who is not being involved in the review to ensure an independent view. A community trigger review cannot be appealed where the complainant is dissatisfied with a particular agency has not utilised a particular enforcement tool. We need to be clear that the community trigger process is not a complaints process. It will not address concerns about a service provided by a specific agency involved in the case, and any complaints related to a particular member of staff or agency will need to go through their individual complaints process. So despite being in place since 2014, nationally, the community trigger remains relatively unknown amongst communities. And in Lincolnshire, we are keen to address this and ensure that we have the best possible process in place for victims. In 2022, the Antisocial Behaviour Core Priority Group undertook a review of the county-wide community trigger policy with the support of ASB Help, which is a charity set up to support victims of antisocial behaviour. In November of the same year, we launched a revised protocol, adopting a nationally recognised best practice approach. In doing so, we have introduced trained independent chairs who will have had no involvement in the case to lead the review. The community trigger SPOCs as a single point of contact for victims. And we now also offer the opportunity for victims to attend the review or provide a written statement to ensure we fully understand the impact that antisocial behaviour is having on their lives. Having now had time to test the new operating procedures, a review of the revised protocol has commenced, just to ensure that it is working effectively and allow us to address any identified issues. The review will then move to annually, which will fall in line with our other partnership policies. We collect data on the community trigger as requested by government, which includes the number of requests, the number that did not meet the threshold, the number resulting in review, and those that resulted in recommendations. This information is gathered on an annual basis from each of the district councils and is then published on their websites as a county-wide figure. The figures for 2022-23 are slightly down compared to the two previous years, but we did see an increase during and immediately after the pandemic, which could have contributed to this. So moving forward, the government has recently announced through the ASB Action Plan that the community trigger will be formally renamed to the ASB Case Review. So at present, all our documentation and literature continues to use community trigger, referencing the ASB Case Review. However, as part of our latest review, we will be transitioning to the new name. But to prevent any confusion to both professionals and the public, it will be referred to as the ASB Case Review, formerly known as Community Trigger. Does anyone have any questions?
Councillor Mrs Clark, followed by Councillor Key.
Thank you very much for that report, and thank you for the clarification. I did request that this information come to this committee some time ago, so I'm really grateful that you've been able to bring that and also produce the report. I would just like some clarification, please, on some of the figures that you've presented in Appendix B. So initially, Community Trigger was introduced in 2014. Can you confirm, please, that the number of applications to the community trigger received is just 12 since that time, because it doesn't make it clear here? And also, you'll obviously be looking for ways for this to be promoted so that this is a service people can easily access. I noticed from reading through the report that perhaps the length of time it takes to do this for victims, and I know it's not a complaints procedure, might be a bit of an off-put, and also a lot of it has to be accessible online, which might also hinder its process. The other thing that I wanted to ask about, on page 24, and you have alluded to that, you've just touched on it, was that it says there that agencies had not been as joined up as they could have been in managing the case. What the learning curve, I want to know what the learning curve outcome was from that, and you have tried to explain that briefly, and how are you addressing that to improve the service in the future, which you have actually touched on. But if you could expand on that, because obviously you'll be wanting people within this committee to be aware of what is community trigger, and it's now going to be given ASB case review, a new name. So we need to be able to understand it and be able to signpost our people to that, particularly in an area where I live that can be quite, where I work, which is quite challenging in St Giles Division. Not always, but sometimes. And people need to feel that there's an outlet, a place for them to go, should things not quite turn out as they would like with antisocial behaviour. Thank you. Sorry, that was a bit long and drawn out, Chairman.
Thank you very much, Councillor Clark. So beginning with your first point in terms of the figures. So the number for 2022-23 was just for that 1 year period. So that was the number that we received in that full year. The figures previously were 17 and then 16. And previous to that, they were considerably lower, looking at more like 4, 5s and 6s throughout that year period. As a county-wide figure, one could say that's quite disappointing, and hence why we are really quite keen to improve our publicity around the community trigger and ensure that our communities are aware of it and that it is available to them to use, should they feel, particularly if they have hit a brick wall and they feel that their antisocial behaviour case isn't progressing. In terms of the actual process, we have stipulated within our policy, and again, we are trying to follow national guidelines. We've worked very closely with ASB Help, who are a national charity, to support victims of antisocial behaviour, to ensure that it is as swift as possible. And within our actual policy document, we're very clear and stipulate deadlines in terms of when the receipt of the request comes in. There are specific deadlines, a number of days that each agency should meet. And throughout that whole process, there is regular contact with victims to make sure that they are still aware that the process is being followed. Obviously, if the initial review has taken place and they don't meet the threshold, again, they will be informed immediately within a matter of days. I think it's 5 working days. And then again, they do have the option to appeal that. Publicity-wise, obviously, we do utilise District Council websites an awful lot. And there is the option to submit your request not only online but within over the phone. You can print things off and post as well. But again, it is something that we're quite keen to do as part of a core priority group to ensure that we are accessible as possible, because we appreciate not everybody has access to online facilities. We did initially, when we launched the Community Trigger, have leaflets and posters, etc. However, the process has changed quite considerably over the years, that trying to keep that literature up to date can be quite challenging, but it is something that, again, trying to get the message out through community groups and councillors as yourselves is one of those methods that we hope can try and improve that publicity. Have I covered all your points? I want to make sure I have. Thank you.
Okay, Councillor Key, followed by Councillor Mr Clark.
Oh, thank you. I'm bothered about the number of people who know about it, and that's what you've been talking about. It says here only 6% of people have heard of it. I assume that means the general population, not just the victims. But what I would suggest, my idea would be that I assume all the district council write to the victims over the course of their complaint, that there should be something in the letter that goes in everybody's letter at the end in a box that says about the community trigger, so that you're telling them in every letter, just at the bottom, a standard paragraph that every council uses that says about what it is. Because the only people who really need to know about it are the victims and the people associated with the problem. So that would save, in my mind, a lot of unnecessary publicity for people who probably won't need to know about it. That would just be my simple idea that would hopefully get them to know about it a bit more. Thank you.
Thank you very much for that, Councillor Key, and I absolutely agree. And we are actually doing some professional training as well to ensure that both within Lincolnshire Police and each of the district councils, not just within antisocial behaviour teams, within noise, housing, that all have a link to antisocial behaviour, do have an understanding of it. And I will take your point back to the Antisocial Behaviour Core Priority Group and put that to them to see whether that's something that they already do and I'm not aware of, or something that they could perhaps introduce.
Maybe you could do a standard paragraph that everybody could have, and everybody put it in the letters at the end. That's what I would suggest. And then everybody gets the same message, and you're not having to send separate things out about it or whatever.
Thank you very much for that.
Okay, thank you. Councillor Mr Clark.
Thank you, Chairman. Several points have been covered that I was going to mention. On page 18, it highlights there that the very known knowledge in the community about the trigger, and then obviously there's going to be the new name. You mention there ways that you're trying to improve knowledge in the local community. I presume we target or send to all the partnership groups so they're fully aware and then can pass on that information. And then further on in the report, on page 22, the figures do seem relatively low, but I'm sure there must be lots of incidents that are occurring that don't meet the criteria where they're highlighted. Have we got any idea of the numbers of sort of antisocial behaviour that are affecting the local communities? Thank you.
Unfortunately, I don't have a figure locally for Lincolnshire around figures of antisocial behaviour. I know that incidents are reducing overall, but I couldn't give you an exact figure, I'm afraid. In terms of the actual community trigger numbers, certainly by no means an excuse, but it is seems to follow that national trend. We're not alone as a county in terms of the number of community trigger requests that are being submitted. And like I say, antisocial behaviour help. We've recently had Antisocial Behaviour Awareness Week again, where it's always also been raised both on a national and local view. So again, it is something that you know, that we will be continuing to look at to try and improve. And it's also trying to understand, you know, are we not getting the community requests because we're doing a good job? And that we've got, you know, our good policies and procedures in place where victims don't feel the need. But equally, we need to ensure that our communities are aware of it should they need it. But I can certainly look into the national figures in terms of ASB and see whether there is any correlation. But like I say, as far as I understand, and Martin may be able to confirm, that both in Lincolnshire, the trend continues to reduce in terms of numbers of incidents, reported incidents.
Yeah, thank you for that, because it does sometimes come out in the media that it's prevalent everywhere. And I've had a couple of instances where people are related to groups of youths deciding to have a bonfire, you know, and then I chased it up, the police were aware, the wardens were aware, so at least the process of communication seems to be working very well. Thank you.
Thank you, Councillor.
Martin.
Yeah, just to come in support of what Lisa was saying, that the antisocial behaviour rates are down within our county, 34% last year to the year before. So we are seeing reducing numbers. That's not as part of the national trend, but it is Lincolnshire trend. So we will continue to map that this year. I mean, it's a positive sign. And I say we've got to correlate our community triggers with what's happening nationally, and I think it's a good benchmark to standards about what should our mean look like within Lincolnshire based on our numbers and volumes. is something we can bring back to the committee.
Okay, thank you. I've got Councillor Sneath, followed by Councillor Danny.
Thank you. I'm a district councillor. I have to admit, I've never heard of this. And I work with an alms house charity, and I get people coming to me absolutely desperate to be moved into alms houses because of the antisocial behaviour they are experiencing. So I just don't know why. I don't feel there's much of a joined up, anything joined up going on, because I would have thought I would know about this. I'm also concerned about the last sentence, which I feel has been very carefully written, and I can't pretend it's very impressive. The applicant was satisfied that agencies had been able to identify some actions which will aim to alleviate the problem. I can't think there's anything very positive in there at all. You know, it's not very strong, is it? And what people want is help. They want support. And I don't feel that's offering it. So, and also, I'm just thinking, if you've got a lot more requests, have you got the resource to fulfil that? You know, if you've suddenly got, if everybody here in South Holland, if I share this more widely, let's say, and suddenly you get lots of more staff, can you cover this? Thank you.
Thank you very much, Councillor. So just going on your last point first, if that's okay. Capacity-wise, again, we've put the policy in place to ensure that we can manage the community triggers as appropriately as possible. The introduction of the community trigger SPOCs is new, so we have that dedicated coordinator that can support those delivery of the community triggers, and we also now have a group of independent chairs to support that process. So I think in terms of our capacity and resilience, it's actually much better now than it was previously. In relation to obviously the case study, this case study was requested from one of the districts in preparation for this meeting today. And I can certainly go back to them, have a conversation around what that means. But I certainly, from my perspective and feedback from the community trigger reviews that do take place, is that we ultimately need to put the needs of the victims first. We need to be important that we manage expectations and that ensure that if we do set any actions as a result of the trigger, that we can meet them. But in terms of obviously what's been recorded, I would expect the conversation would have been had with the victim, and the victim will have been satisfied with that outcome, and if they hadn't, then obviously a further conversation would have been taken place. Obviously, unfortunately, with the way that the appeals process works, and that has been set by government, that an appeal can't be made if they're dissatisfied with the result. The appeal is more of a desktop exercise to ensure that due process is being followed. And again, picking up your point around you're unaware of it within your district, again, I think that's something really important to take away today, and something that I will raise as a core priority group, because when we relaunched the policy in November last year, quite a lot of work went into publicising it, both across the county and within individual districts. So it'll be really interesting to understand why that message hasn't got to you. So thank you for that, and I will take it back.
Okay, thank you. Councillor Danny.
Thank you, Mr. Chairman. My first question is, first of all, thank you for the report. It's very interesting. It's the first time as Councillor Sneath to hear about community trigger. And my first question is, do you relate to, make a liaison within the police and the local councillors in these matters or not?
Yes. So the community trigger is led by the district councils. They coordinate it, but they work very closely with police as one of the relevant bodies that should be involved in community trigger. So yes, that is.
Thank you very much. Well, I have received a lot of, as I'm a local councillor also in Boston, I have received a lot of phone calls regarding antisocial behaviour. Now, the people committing these antisocial behaviour, most of them, they are very smart. They know the law. So when people complain about them, they go to the council and then they get stuck. When they call the police, probably they come and visit the place, and then there is nothing at that time. So they go back. So you keep playing cat and mouse all the time. There is people who feel depressed because of the antisocial behavior in their neighborhoods. So they don't find any support in our local council, because I'm helping some people now. They're complaining about the same person on a daily basis and nothing has been happening. My question is, I mean, we are here towards to create a healthy communities, and that's what we are here for. My question, how much support, I mean, if you inform your local council and the police about antisocial behavior and nothing happens because the people, they lose their faith in these matters when nothing happens, how much support do you give to these people when they report it?
So on the initial reports of antisocial behaviour, there is the option to refer to victim support services. When they actually do send when the community trigger review is received and the initial review is taking place, they do write within that letter an offer for support through victim support. Unfortunately, with the way that Ministry of Justice funding at the moment, we don't have a dedicated victim support service for antisocial behaviour. It is something that we have had in the past, but unfortunately with funding constraints it wasn't able to continue. So we just try to utilise the services that we do have, which is through the victim support advocates. They also are heavily involved within our ASBRAC process, which is the high risk, more complex cases of antisocial behaviour in order to offer support. And we can also direct them to literature websites such as ASB Help, which do offer lots of advice and guidance around what they can do to try and either progress their antisocial behaviour case. They're very obviously pro-community trigger to ensure that people push that. But yes, so we will refer to victim support and we will offer it and do that referral on their behalf. Or there is the option to also self-refer now as well.
Thank you, Mr. Chairman. I would like to see in our councillors giving us probably, as we call it, crash course, or just a rough idea how you work, because as councillors need said, I've never been aware of this community triggers, to be honest. Otherwise, I will be the first one to to contact and see what we can do. If you can come to our councillors, they are more than welcome to tell us what's going on.
Absolutely, more than welcome to do that. Not a problem.
Okay, thank you. Back to Councillor Mrs. Clark.
Thank you, Chair, for indulging me here. Just briefly, on page 24, on the second to last paragraph, you make reference to the case study there, and you make reference to a Section 21 notice. Not everybody here will understand what a Section 21 notice is, and I've just had to Google it to find out what that is. So it's like repossession of a home or asking somebody to leave. Can I just ask that for future reports that we don't have that and you explain what that is in brackets so that everybody understands, and also there's also time involved in that as well, because getting somebody to leave a property, that's also time involving. So I really appreciate the report that you put everything together, but if you could just make it just that bit simpler, so when you come across those kind of things, just explain what they are. Thank you very much. Thank you, Chair.
Thank you very much for that. I will ensure that.
Okay, thank you. I can't see any further speakers. No, okay, thank you. So thank you for your questions and comments. That now concludes the discussion of this item. I did have a question for you, Lisa, but it's been asked by others and succinctly answered by yourself, so thank you for that. Lisa, will it be possible for 12 months' time to bring a report back to us? Do you think that's the sort of timescale we're looking at?
Yes, absolutely, Chairman.
Okay. So firstly, I'm going to thank you, Lisa, and the Safer Lincolnshire Partnership team for a detailed and comprehensive report. Secondly, to record following key findings of this committee. I think some of the key questions there was awareness, management, numbers recorded, and explanation of things like the Section 102. That's been noted along with other items which have been discussed. So I'm going to move that the report be endorsed, that the committee's satisfaction be recorded on activity undertaken by the Safer Lincolnshire Partnership and the Antisocial Behaviour Core Priority Group in raising awareness of the community trigger. And finally, I ask that a follow-up report be submitted in 12 months' time to update the committee on progress achieved against set targets and the overall developments of the delivery plan. Can members please raise your hand if you agree with that? Okay, thank you very much. That's carried. We're now going to revert back to our Public Protection Community Scrutiny Committee duty and move on to item 6, which is the Coroner's Service Annual Report. The item can be found on pages 25 to 30 of the agenda pack and provides an annual overview of Lincolnshire Coronial Service, informing us of successes and challenges experienced in the past year, as well as future plans. The report is in accordance with the requirement of His Majesty's Chief Coroner for England and Wales. Our actions is that the committee is invited to consider and comment on the contents of this report and consider timescales for further reports as required. The report will be presented by Paul Smith, His Majesty's Senior Coroner for Lincolnshire. Just before we go over to you, Paul, I know Councillor Woolley is itching to talk to us, so I'll go over to you now, Sue.
Don't know about itching, but Chairman, you have already touched on this earlier in your announcements, but I just wanted to make the committee aware that this year, at long last, this report will be delivered slightly differently from the point of view of Mr. Paul Smith is no longer our acting Senior Coroner. At long last, the Chief Coroner allowed us to go out to open competition, and I'm delighted to say that Mr. Paul Smith was successful in becoming our Senior Coroner for Lincolnshire. Thank you, Chairman. Over to you, Mr. Smith.
Thank you. Paul.
Thank you, Mr. Chairman, for those kind words. When I appeared before the committee last September, I talked at length about the pressures faced by the service. Although it was a report on 2021, the pressures that the service faced were current up to the time at which the report was delivered and indeed beyond. That being so, I suspect it would not be best use of committee time this morning if I was simply to reheat and reserve what I said last year. So the approach I bring today is to focus on the headline figures for 2022 and to offer the committee what I hope are reasons for optimism looking forward. In terms of the figures for 2022, the committee will see that it's been a very busy year. Coronial referrals were up some 9% year on year to a figure of 3,229 last year. The number of post-mortem examinations required was similarly raised, up 8%. Whilst the inquest rate dropped slightly, the increase in figures meant that the number of inquests opened remained broadly constant at a shade over 500, appropriately adjusted. Perhaps the biggest increase, Mr. Chairman, was in the number of inquests which were completed last year. That figure was increased by some 17% year on year, 22 against 21. A total of 523 inquests were completed, which together with those cases permanently suspended following criminal prosecution meant that the service completed 541 cases last year against a figure in 2021 of 466. The consequences of that increased volume were such that by the end of the year, the number of open cases reduced from a high water mark in excess of 420 to a total of 363 open cases. Mr. Chairman, if the committee will permit me to refresh those figures further to the end of June this year, the end of Q2, I can tell you that during the first half of this year, a further 299 inquests have been completed. That is exclusive of cases suspended for prosecution, an increase of a further 14% on the figures recorded last year. If one steps back and looks at a slightly longer focus, that affords a cumulative increase of some 34% in completed cases since June of 2021. And indeed, if one steps back even further and looks at a baseline figure for completed inquests between 2017 and 2020, the output of the service in completed cases is now approximately 50% higher than it was at that stage. The net effect, of course, is that the open caseload has continued to fall. We're now down to 314 cases or thereabouts. The number of old cases held by the service has dropped from a figure in excess of 100 to 75 cases at the end of June 2023. And indeed, when I did a quick head count yesterday, I'm pleased to report that as of today, that figure stands a shade under 70 cases. So that is dropping quite sharply. Timeliness to inquest remains above average at 37 weeks, but perhaps given the volume of old cases which are currently washing through the system, that is unsurprising. We are a little behind the national average, but still in touch with the pack, if I can put it in those terms. There is a large spread nationally in terms of timeliness, and we are significantly above many of the areas beneath us. The reasons for those improvements, well, firstly, as always, I pay credit to the commitment of everybody in my team. Secondly, I think it's important to record that I believe the service is now in a position where the structure is correct. We are benefiting undoubtedly from James Chappell as head of service. It's unfortunate that James is on leave today, so cannot be with us, but he deserves significant credit for the improvements which have been made. And the service is, I would suggest, now appropriately resourced for the volumes that it has in terms of both assistant coroners, coroners' officers, and of course business support personnel. In terms of looking to the future, Mr. Chairman, the issue of premises remains unresolved, but I'm hopeful that those issues will be resolved within the foreseeable future. There is, I'm told, an open competition to launch later in the summer for a second full-time coroner, that of an area coroner. That will put us back in the position that we should have been in throughout, but of course there has been no second full-time coroner in this area since 2020. And I'm hopeful that with a full complement of coroners, further progress can be made. We've already heard from Martin Parker, of course, in relation to the merger. The consultation has been launched. Interesting times, Mr. Chairman. I very much hope that when I come back next year, I will be delivering a report to you on behalf of the Greater Lincolnshire Service rather than the simple Lincolnshire Service. Once all those matters are resolved, as I say, I think that we can look to build to the future with increased optimism and confidence, and I'm happy to take any questions which arise out of my report.
Okay, thank you. Councillor Key.
Yes, thank you, Mr. Chairman. It's the thing I always bring up. I work in the funeral profession. I'm a funeral celebrant and have been for 15 years. And when I started doing that, I worked for the registration service. And at that time, that was the time that post-mortems were taken out of county. And it's my big bugbear that I have, because obviously I deal with thousands of families over those years. And the one thing that I find upsetting is when families don't know where their bereaved are, because they could be en route out of county for a post-mortem, en route back. They could be with the funeral director who's not their funeral director. They're just the person who's moving the deceased from one place to another. And I do think we need to be looking towards bringing post-mortems back into the county again, because we are a really big county, a rural county, and people are really upset when their deceased is taken into another county for a post-mortem. It sounds probably a bit of a minor point, but it isn't if it's a member of your family. And now we've got the medical school at the university. I think, you know, it's only the right thing to do. And I was told when they initially left the county that it was a cost-saving measure. And I can't really believe that it did save money because of all the transport costs involved. So it's my bugbear that I always bring up on occasions like this, and I should continue to do so, speaking up really for families who I deal with all the time. So please, could we look to bring post-mortems back into Lincolnshire? Thank you.
We do have this further on in the agenda, Councillor Key, regarding facts and figures regarding that, but over to you, Paul.
Yes, I was just conscious that that was in the exempt section.
Councillor, you're right in that our post-mortems are dealt with at Hull, at Leicester and at Peterborough. I too would dearly love all post-mortems to be dealt with within the county. There is a national shortage of pathologists. There is a shortage of pathologists at Lincoln. And I believe I'm right in saying that when we were looking at the tender for post-mortems, Lincoln didn't have capacity to satisfy the volumes that we have. Perhaps a conversation for a different day, but certainly in spirit I'm with you.
Thank you. It's the same old story. Once you've lost something, it's very difficult sometimes to get it back. And the reason perhaps that we've nobody in Lincolnshire who can do it is because we lost them in the first place when we moved it out of county. but that's, as you say, something for another day. Thank you.
Thank you. I have to say I do share those sentiments, Councillor Key. Any other questions? Oh, sorry, Councillor Mr Clark.
Thank you very much, Chairman. I notice on page 27, it says that the assistant coroners sit approximately 20 days a year. Are we able to increase that automatically to maybe deal with the backlog, or is it a cost problem? Thank you.
I think, like everything, Councillor, resourcing is an issue. The expectation is that assistant coroners are provided with 20 days a year as a baseline. All of them have other roles. All of them give of their time when they can. It isn't just, I think, a question of getting the assistant coroners in. It's a question of getting files prepared. It's a question of having sufficient courtrooms to put cases in. I would encourage you to celebrate the progress that we've made and look forward. The issue is not just a question of getting additional assistant coroners or indeed increasing their volumes. We're very fortunate with the complement of assistant coroners that we have. All of them bring individual attributes and individual benefits to the coroner service, and I'm satisfied, certainly on the basis of the figures from the first 6 months of the year, that we're making significant progress in reducing the backlog.
Thank you for that. I noticed further on it mentions various stats on page 28. Could you give us some examples, please, of accident or misadventure? It seems a rather wide spectrum when you've been quite specific in other areas. Thank you.
I can give you the legal definitions, Councillor. An accident is an event over which there is no human control. It is also a death which results from an unintended human action. Misadventure is the other side of the coin. It's where you do something deliberately and your death is the unintended consequence of a deliberate action. Giving specific examples is difficult. The example I often give when I'm training is that if I climb a ladder and I decide when I get to the top of the ladder that my life is not worth living and I jump and I die, that is suicide. It's a deliberate act, and I've determined that I want the conclusion to be that I end my life. If I lose my footing on the ladder and slip, that's an accident. If I decide I'm going to slide down the ladder because I want to get down to the bottom more quickly, because I want to watch something on the television, for example, that's about to start, I misjudge or I jump from the 8th or the 10th rung, satisfied that I'm young enough, fit enough and agile enough to withstand the drop, and I make an error of judgment and I die. That's misadventure. Every case is different.
Thank you very much for that explanation. Further on, you mentioned that there's arrangements to appoint an area coroner in January 24. Could arrangements not be made to bring that earlier to aid in your work? Thank you.
Mr. Chairman, Mr. Councillor, I would be delighted if that's the case. I can tell the committee that I'm advised by James Chappell that the area coroner pack is ready to launch. It will go at the beginning of August. There is a provisional date because the Chief Coroner has various timescales for the stages in such an application. A date has been penciled in for interviews towards the end of September. Once the decision has been made, it needs to be verified by the Chief Coroner and by the Lord Chancellor's Department. Once the successful candidate has been appointed, one imagines they will have a notice period to serve with their current employer. So if they are able to leave sooner and join me sooner, I will welcome them. But being pragmatic, it will be the beginning of January.
Thank you very much indeed.
Councillor Danny.
Thank you, Mr. Chairman. Just thank you for the report and congratulations for your post. I'm just going to page 26, point 14, Lincolnshire Coronial Jurisdiction. It just, when you read, the bullet points here, I just want to ask you, probably out of curiosity, what about train accident or, train fatalities? Does it have any relation to that? Because you say the overload of work.
The paragraph 1.4 just highlights the major areas within the county. Every county within the country has virtually every area has a train line. I can't give you the number of specific train deaths that we have. I can tell you that the majority of them, anecdotally, will be suicides rather than accidents in the purest sense. We have a number. I don't think we have a sufficient number to put us above or to make it a particular area of concern, over and above, of course, the level of suicides, which is a matter of national concern.
Okay, thank you. Paul, someone asked about accident or misadventure. I noticed there's been a significant increase in those two headings. Is there any particular reason why?
Mr. Chairman, I knew someone was going to ask me that, and I'm afraid I can't give you the answer. All I can say is that my service has to deal with whatever comes through the door, and I suspect, and it is a matter of speculation, if you look a little further down the column, you'll see we have a lower figure for deaths from natural causes than the national average. I suspect that the answer lies in that many, particularly the elderly, when they pass, die as a consequence of a number of factors, and often a fall and a broken bone is included. It may simply be that the personnel hearing those cases place particular store on the fracture or the broken bone rather than the underlying medical conditions. Every case is different, but of course when one looks at the volume of cases we're dealing with, whilst the figures are significantly greater, if we were to drop back to the national average of 25% rather than 29%, I haven't done the arithmetic beforehand, but I suspect that we would be looking at teens of cases rather than a higher number, which, given the volume of cases we have, is perhaps not that significant.
Thank you, Paul. And not wishing to put you on the spot, but I notice suicides are steadily increasing too. And is there any rationale behind that?
I don't know is the truthful answer,
Okay.
Mr. Chairman. All I can say is we do provide our data to the appropriate agencies, and we will continue to cooperate fully with them with a view to enabling services to reduce the number of suicides, to be targeted and tailored in the appropriate way.
Sure. Thank you, Paul. And I do feel there's light at the end of the tunnel with the proposed merger, so that's good to hear. Okay, I can't see anyone else wishing to ask any questions. So thank you, Paul, for your report. I do like your ladder analogy. And I'm going to suggest that we record all the key findings. Some of those was about statistics, some about the merger, some about the out-of-county post-mortems, but they're all been recorded anyway. So I'm going to move that report be received, that the committee's satisfaction be recorded on activity undertaken by the Coroner's Service throughout 2022, and I ask that a follow-up report be submitted in 12 months' time. Can members please raise their hands if they agree? Thank you. That's all agreed. Thank you. I'll now move on to item 7, which is the service level reporting against the success framework 2022-2023, quarter 4. Excuse me. This item is on pages 31 to 60 of the agenda pack. The report reflects on the performance achieved in quarter 4 that is relevant to community safety, trading standards, fire safety, libraries and heritage, road safety and volunteering. if it's okay with those that normally present, I'm going to take the report as read, yeah, and ask committee members for any questions they may have. So, page 32 to 34 deals with domestic abuse and trading standards, which is Martin's area. Do members have any questions for Martin? Councillor Clark.
Thank you very much, Chair. On reading, and thank you for the report, detailed as usual. I have some questions on ending domestic abuse now, that's Eden and Marrack. I was looking back at the past papers, and on quartile 4, the report we've got now, we've got 498 children and 490 adults being seen or looked after. But going back to quartile 2, on the Eden phone calls and up to quartile 4, sorry, this is coming out wrong. It seems to, on the Eden phone calls, they seem to have increased quartile on quartile. So on quartile 2, we had phone calls to Eden 1,922, quartile 3, 2,939, and now we've got 4,065. I just want to know, are you aware of that increase there, and what's happening there? Are more people being addressed or coming through the system? Because the numbers for people being helped or looked at there are coming down, and I'm pleased to see that, but the phone calls are going up. So I need to know what's happening there. It's just an observation and a question of mine. And also on Marrack, if we're going through it now, usually when there's a report on Marrack, it starts off with the same paragraph. They meet virtually, everything seems to be going well, and then the figures are not, I can't really make sense of the reporting and the figures, and it's very brief. Given the fact that there's going to be other things that are going to come through this committee and maybe adults around other things that we're looking at to develop within the county, and I'm looking at women's centres. So I would have thought that we need to really, could I ask for an improvement on the reporting from Marrack? I'm pleased to say that they're going to be meeting face to face twice a year. They're going to try and do that rather than just virtually all the time, which is great. And I know it's a large organisation partnership, so it's not going to be easy for people to come together. But I do feel that perhaps in view of the way we're looking at what we're trying to improve within the county, that perhaps that reporting could improve as well. Thank you, Chair.
Thank you. Martin.
Thanks, Councillor Clark. I'll take each brief. I'll take the first one in relation to phone calls. So I think there's been an increase based on the fact that our recording of it is better. I think we've got in a position with working with Eden Links about how actually we track and record actually who is taking that one-on advice, because some of it's not always a telephone call, some of it's visits to their website as well. Actually, that is somebody looking for advice and what that self-service is. So there's a difference between what is online and then what calls come into service. So we've recorded how we are supporting people in terms of what's the footprint on the website and also what's the footprint through phone calls. I agree with you entirely around the Marrack aspect. I was reflecting when this kind of report came together is that it doesn't give us a narrative about how we are supporting individuals within the process, and also actually even within the End Domestic Abuse Eden Links now, which is now LDAS under the new Commission Services. You'll notice that in the performance reporting section for this year, we've actually removed domestic abuse to be reported. You will get a report at the end of the year, but actually not into the level in terms of facts and figures, because we're looking about how we can report a better commissioned outcome of victims into scrutiny. So actually, you know, we might have seen 400 people, but what did that actually mean to them? What did they get? What was their outcome? You know, how did that make their lives better? And certainly when I look at volumes in the Marrack, you know, they've dropped significantly, which is a really good news story from year on year, which means we're having fewer high risk cases within the county. Good news. But actually, what is the repeat look like? You know, so actually, are our repeats going up? So how effective is Marrack working? You know, I'd expect there to be greater narrative around our repeat victims into into Marek and how actually we are managing and keeping those numbers down as well. So the combination of new commission services through LDAS, we're reviewing the whole of the report and metrics around domestic abuse to make it effectively more meaningful to you as a committee, but also more meaningful to members of the public about what actually has worked and what actually has been the result with victims. Does that help and answer the question? Thank you.
Thank you. Councillor Mr Clark.
Thank you very much, Chairman. On page 32, there's a graph there showing an ever-increasing number of contacts, and it always seems to be the fourth quarter that's the highest amount of calls. Is there a particular reason for that? Is there or just that's the way it goes, or is it people becoming more aware throughout the year and it all sort of targets in quarter four? Is there a rhyme or reason for that, please?
What I should look into, I'm not sure why that works, because it should be fairly instant. I think the figures are put forward in terms of it's a cumulative number, so that's why quarter four looks like 4,380. But I think that's an accumulation through the year, which would then equal out about 1,000 per month, 1,000 per quarter. But I'll check that, because that would be a rationale about why that looks bigger.
That certainly looks to be the case.
Yeah.
Sorry, that certainly looks to be the case, yeah.
Yeah, I've got a further question. On page 35, it mentions recalls on various products, electrical ones and household furniture. Is on the electrical products, for instance, is it because it's faulty, or doesn't it meet a particular standard and they're rogue products? And on household furniture, is that foreign imports, therefore they don't get the British standard? Possible explanation, please.
Mark, Martin's asking you to answer that question, if you could, please.
Yeah, Mark, it was around the electrical goods that were seized from that one business in Boston, and also the furniture. What were the standards that were breached that took them out of service? Was it the fact that they were foreign furniture that didn't meet British standards, or was it electrical issues, one with electrical, one with furniture?
Okay, so the items that were seized, the electrical items, it will have been under electrical safety regulations. The non-compliances generally that we identified were around labelling of those. Off the back of that labelling problem, we submitted samples for test, and we got the test results back on those. Some of those were just unsafe and couldn't be dealt with other than to totally remove them from market. So they were suspended, signed over and disposed of. The others, there were labelling problems that could be worked around to bring the items back into compliance. So we used notices there to work with the company, did further checks on what they were doing to ensure that compliance, and once we were satisfied, then those products could go back on sale. With the furniture, a lot of it was household type goods, so we're talking things like rugs and some flat pack furniture, that type of thing. So again, the specific regulations about the labelling of textile products. Some of it is fire safety related for those as well. So we're satisfying ourselves that products are compliant, and working with the business to get the labelling up to scratch so that it can be released for sale. With things like flat pack furniture, it's the quality of the instructions for actually manufacturing the product or putting the product together, making sure there's appropriate instructions, they're safety instructions. So having products that are likely to tip over, having a connection to the wall, one of those type warnings. But again, a lot of it is around traceability as well. So having proper contact details, batch numbers, that type of thing. So again, just general product safety for those.
Thank you for those explanations. Thank you.
Thank you. Councillor Key.
Yes, thank you, Chairman. This is a point I always bring up when these figures come forward, and that's the high-risk premises inspected by trading standards. 26 food inspections, which is one a fortnight, and it's less than the weights and measures inspections. And when this was discussed before, we talked about liaison between the district councils and the county council and the food hygiene inspections that the district councils do. And I suggested that if a premise has a 0-star or 1-star hygiene rating, that those referrals are referred automatically to trading standards, because the chances are those businesses are also failing on trading standards matters. And I think up to that time when I asked, the process was really a bit of an informal liaison between the two, phone calls and sort of contacts between the two, and I suggested it would be formalised that there was an automatic referral if a premise failed its food hygiene inspection. And I just wondered if any progress had been made in that regard. Thank you.
Mark?
Yeah, happy to clarify on that. Yeah, that figure of 26, it looks relatively low, but it is based on the FSA risk assessment is actually higher than the number of high-risk premises that that risk assessment produces for the records that we have for the county. And is only part of the food inspection work that we do. We do a lot more than that number that is printed there. That is just the ones that we identify as high risk at the start of the year. In terms of the liaison with environmental health, I have asked our lead officer for food and the principal to get together with environmental health to make those arrangements to have those 0 risk rated premises identified to trading standards. So it is ongoing and it's being actioned.
Okay, thank you. Councillor Danny, followed by Councillor Mrs Clark.
Thank you, Mr. Chairman. My first question is about domestic abuse. I'll just speak about Boston because I noticed that some abuse is going on in the streets. And I seen a man spitting on his wife. I seen a man pushing his wife, hitting his kids. And I reported to the police. I would just like to know how to approach the situation, because most of the time the police go and talk to these people and say, oh, nobody wants to press charges. So how can we deal with it? Because it just puts you in a big, not sort of stressful situation, basically, because when you report it, nobody deals with it. And I don't know what to do next, because it's very sad to see someone discriminating his own partner, with certain behavior. Thank you.
Martin?
Yeah, so it's a really challenging situation because you are a member of the public that's possibly putting yourself at risk of confrontation and also assault from the individual getting involved. The way to deal with it is, ringing the police on 999 because it's a criminal act that is happening there and then, and something that then will be responded to. So it's not something that cannot be responded to if you're able to articulate. If you're able to take any form of recording of what's happened to get that in terms of the evidence, depending on where it is. If you think that something is so severe that you feel that someone is going to come to some significant harm, you can interject and have the sort of the lawful right to say that, to stop that behaviour in terms of significant and serious harm happening to somebody. But I would recommend that if an act is taking place there and then, that you contact the police straight away and tell them it's happening there and then in the street.
Thank you. If I may come back. Yes, I did that, and the police came and questioned the person in question, and basically the lady refused to press charge against the husband. So they say we just leave it as it is.
So did they? It's difficult to get into specifics, but we have a basis where we do not need either person's consent or agreement to take someone forward for prosecution. We don't need their consent to do it. If we've got sufficient evidence to go to the Crown Prosecution Service to show that an offence has been committed, we don't need their consent to do it. And we also have lots of other non-criminal process procedures that we can put in place to protect victims who are not engaging and willing. Through the domestic abuse violence production processes, we can put restrictions on people's lives through the civil courts in relation to it. So there are a number of options. So just because somebody doesn't end up going to being charged or taken to court, there are some civil orders that we can put in place that that restricts people's contact. And that's regardless whether they are willing or not willing as victims.
I have one more question, Mr. Chairman.
Go ahead.
Sorry, it's regarding the e-cigarettes. I mean, I think trade and standards, because I think lately we have been hearing about it. I think Wales, Ireland, they are trying to ban them for selling them to underage, kids and children. And I think that's a big problem, because now most of the kids going to school in the morning, all of them, they have e-cigarettes, and we know the danger and, which is can, create to them in the future. Is there any answer on that one? Thank you.
Again, we do have this further in the report, but
Yeah, I was going
Martin.
to say, Mr. Chairman, if we can pick that up when we come future in the report, 'cause we've got quite a big input on that later on in the agenda.
Okay, Councillor Mrs Clark.
Thank you, Chair. My question actually is around vapes, so I'll save that for later because that's really quite important, and it would be remiss of me actually not to bring it up given all the hype there is around it. And I know you're very careful around vapes and the figures around that. So the other question I will have then for you is about weighbridges. I thought that was a really interesting point there that was made there about weighbridges, and it's something that I don't think we've ever really picked up on here. So I would like to ask about the inspections that 10 were unable to be taken place due to the problem with the hire of equipment. And also, if you could expand on that just briefly, just if you can indulge me, please, Chair. And also, how many do we have weighbridges within Lincolnshire? Thank you.
Well, the number, I'm not entirely sure on, but I can find out how many we've got records for all. In terms of the equipment, we don't have the equipment ourselves, don't hold it ourselves to test those. We used to, when I started in trading standards many years ago, we had roller weights that we could take out on the back of a highways truck with a high ab. I think the health and safety man would probably have a heart attack these days if we were doing that. So we hire in specialist equipment with 1 ton block weights and a forklift truck. So we hire the truck, the driver, and all the equipment to do that. It's availability, because there aren't many people. I don't think it was cost last year. I think it was actually availability. But we'll look to try and get that sorted this year, because it's an area we've not looked at for a considerable while now. And it would be good to know if there is a problem with the weighbridges around the county.
Yeah, just on the weighbridge situation then, so that's goods coming in and out of Lincolnshire, and obviously the weighbridge is to determine the weight of the whatever is in those, and that's really important given the fact that we have problems with stuff that's coming in and out, trading to be sold, could be people, don't know. So actually I think it's something that maybe we need to pick up on and look at. Is that something that you can come back to us on with and look in, kind of investigate and bring something back? Is that all right?
I'm sure we can pull something together.
All right. Thank you, Chair. Thank you.
Okay, thank you. I can see no further questions on the topic of domestic abuse areas and, and trading standards. But it has been noted some key findings there regarding MARC recording of domestic abuse cases, trading standards, unsafe products, the liaison between district and county councils and weighbridges, so that's all been recorded. We'll move on to the next part, the next heading, which is fire, which is on page 35 to 45. We have the Chief Fire Officer here and Assistant Chief Fire Officer. So I'm taking it as read, so any questions for that subject area, please? Okay, while we're thinking, I'll think of something to say. So can you explain to the committee, Chief Fire Officer, about what a response time actually is? For instance, is it when someone makes the call, when the call is received and acknowledged, or is it the time of alert, or where does the response time start and finish, please?
Yeah, thank you, Chairman. Yeah, so the response time is from when we receive the call, and it is broken down how we measured it. So we do have a performance measure in regards to how long it takes our control operators to speak with the person who's dialing the 999 for them to identify where that location is, and then for them to dispatch their nearest asset. We often do that with under 2 minutes, and that's a reasonably quick time in regards to gathering the information from people who are usually in a fairly highly stressful situation for them to calm down and also to give really important fire safety advice to that person on the phone. So they're doing multiple jobs at the same time. And then, as you rightly say, there is another area that we monitor, particularly in regards to our on-call stations, is in regards to, as soon as we alert the stations, we measure the time that it takes for them to respond into the station and to be able to allow the fire appliance to be mobile. So we look at that timing as well. And then the final part of the measure is the distance from when they leave the fire station to actually arriving at the incident. So they're the really three main areas of the response time.
Okay, thank you. Councillor Key.
Yes, thank you, Chairman. I was just thinking, and I haven't got the figures as to when the change happened, Sleaford Fire Station and the changes that took place there. As I say, I can't remember when it was coming in, but have there been any change in the response times from Sleaford? Thank you.
Yeah, that's a straightforward one to answer, because we have delayed the start time for that through consultation with our staff and also some ongoing analysis of a wider resourcing project. We're committed to starting that new pattern on the 1st of January 2024, and then we will be monitoring the performance and any impact that any changes will have. Again, just to give some confidence and assurance, it won't affect any response times during the day, because we still have a whole-time personnel on the station during the day. And in the evenings, we still rely on our on-call personnel coming into the station, and during the evening, both our whole-time and our on-call currently have the same standard in regards to responding to the station. So we don't anticipate there being a significant difference, but we will be monitoring that from the moment that we implement.
Thank you. I'll ask the same question this time next year then. Thank you very much.
Okay, thank you. Regarding the home fire safety visits, I think there's been a bit of improvement on that from what I can see, but just could the target possibly have been a little bit ambitious at the outset? Ryan, it looks as though you've got that one to answer.
Yeah, thank you, Councillor. Yeah, the committee will be aware we've discussed this target, the stretch target, over the past 12 months. There's an argument either way, to be quite honest. We've done the analysis. We understand we've seen a significant improvement in the number of home safety visits that our staff have been able to undertake over the last 12 months. In fact, we've seen an improvement of about 2,000 additional safety interventions that we've managed to accomplish. Looking at an average of the other remotely rural fire and rescue services in the country, we sit about average. So the question is, why such a stretch target? And it's simply because we recognise that we do have a disproportionate ageing community within Lincolnshire. We've consulted with the Joint Strategic Needs Assessment, and we understand with our colleagues in public health that we do have a disproportionate risk within the county. So, of course, our aspiration is to undertake more of those safety visits. Yes, it is aspirational. Yes, it is there to drive almost a codependent work across a number of streams of our organisation. It's not simply there to sweat the asset and make staff work harder. It's there to make some of the behind-the-scenes systems work as well. So some of our referral mechanisms, use of data with partners, etc. So in answer to your question, yes, it is a stretch, but it's there for a very good reason.
Okay, thank you. Regarding the Sherman campaign, I think on page 43 it says a meeting planned for, was it the 4th of May? Did that take place?
Was this around partnership and data referrals?
Yes, on page 43, sort of second paragraph-ish. Whilst the results show that Sherman campaign remains relevant, a meeting is planned for the 4th of May with the integrated risk team, so that clarifies it a bit more. So
yeah, absolutely.
Did that take place, and what was the upshot of that?
It did. So our integrated risk team is an internal team that looks at the data analysis, looks at historic fire data trends, looks at data trends across the country, and then locally the types of fires that we're attending within our county, and then of course the fires within those where accidents, injuries, and sadly deaths occur. Yes, Sherman still remains relevant as a model for being able to identify the most vulnerable in the community. So smokers, hoarders, elderly, or those living alone, reduced mobility, mental health, those with alcohol or drug dependency, and those people who have additional needs of care or support. clearly I know that you knew that, Councillor, but just to remind other people.
Okay, thank you. I can see no further questions for that subject heading. I think the key things to note there was the response times, the number of home fire safety visits, the Sherman campaign, and data trends. So no more questions. We'll take the next one as read also, which is page 46 to 48, Libraries and Heritage. We have Will Mason here to cover that. So again, taking it as read, so do we have any questions for Will, please? Will.
Thank you. I was quite conscious there's no questions. I didn't want to miss the opportunity to share with everyone.
Exactly so.
That actually, for the first time in our history, with the final numbers for last year, Lincoln Castle Grounds made it into the top 20 visited free to enter attractions in the entire country.
Okay, well done. Thank you.
Thank you.
Thank you. You got away light. I've not got a question for you either. Okay, so the next subject heading, I believe, is road safety. We've got Rob Hook here today, Enforcement Delivery Manager for the Lincolnshire Road Safety Partnership. Those items are on page 49 to 50. Again, taking it as read. Any questions for Rob? No. I'll just ask one. I know I've mentioned it before to Steve, Rob, that, and I do know it's beyond your control too, but I've mentioned it before that the table of statistical neighbours, yeah, we're also at the wrong end of that table, yeah. If we had other statistical neighbours, I'm sure there's other counties in England who probably fare worse than us, and if we was in those tables, we wouldn't look quite so bad. So I do know it's beyond your control, but just want to know your thoughts on that.
Yeah, good morning. Yeah, I agree wholeheartedly. Unfortunately, it is beyond our control. The problem we've got is that we're a big county, and all of our neighbours are very small counties. So we're probably not reflective if we just work on the neighbours like that. Unfortunately, as I say, it is beyond our control when you look at the comparisons.
Sure. Yeah. Okay, I can see no question. Oh, I've got one. Councillor Key.
Yes, thank you, Chair. Just a quick question. One of my parishes have a very active speed watch group. They do everything they can in the village. They want to know what more can be done to help them. They've got a busy road going through the middle, like a lot of Lincolnshire villages does, and it's not through lack of the village effort, because their speed watch group is one I hold up to all my parishes as an example of how it should be run. But they just want to know what else either the county council or the road safety partnership can actually do to make their village safer, because there are children and everything in there. So it's what more can we do? Thank you. And they've got the reactive speed camera, speed indicators.
It's a very difficult one to answer on specifics without knowing obviously exactly where and everything else. There are things that we put in place with regards to the Road Safety Partnership will do monitoring of the traffic volume and speed to get an idea of the general flow of traffic through a village and to look at the levels of speeding generally. Obviously, from an enforcement point of view, the Road Safety Partnership can only use speed cameras, and we have to meet the criteria that is set for us with regards to the placement of cameras. That doesn't mean to say that the police can't do additional enforcement because they're not quite so restricted. So once we've done the assessments of a location to look at what is available, and that's also looked at from the accident investigation partnerships from LCC, to look at whether there's any additional work that we can do with regards to signage, etc. Then we do share all our results with the police in the hope that if they have the time, obviously, that additional enforcement can be undertaken. I know with CSW, which is a very, very valuable tool, and a lot of groups do some amazing work, sometimes they feel under-supported by the police because they are out catching people that are clearly travelling in excess of speed through the village, and they would like to see police officers more often, but obviously it's down to demand with everything else that's going on. So what they can do additional is very difficult. If they've already got the reactive signs and everything else, it's a hard one to answer, unfortunately.
Are we still recommending the village gates? Because they are expensive for parishes to buy, but are they still seen as a extra thing that parishes can have?
Certainly not anything, unfortunately, that's within my remit, but I know they are used quite often, and they are very valuable. From what my personal point of view, when you see them, it does help to focus that you are coming into a speed limit. It's a defined change between one speed limit and the next. So certainly I believe that they are a very good tool, cost aside, unfortunately.
I think they also have the effect of sort of the perception of narrowing the road, don't they? So
Yeah,
I think
yeah,
they-
absolutely. It's just it just focuses your eyes down to I'm coming into a change in tarmac. Something's happening, and hopefully makes people slow down.
Yeah, the consensus in my parishes has been that they've looked at both those and the speed indicator devices, and the speed indicators have won, and the gates are seen as an extra, and that's what I've sort of come to decide myself as well, particularly in view of cost. So thank you.
It's down to resources all the time, isn't it? So you have to prioritise, unfortunately.
Okay, so I've got Councillor Mr Clark, followed by Councillor Dunny.
Thank you, Chairman. On page 49, we have the figures of killed and seriously injured. Are we able to differentiate and highlight the number of motorcyclists and then target them? Because on the top road where I live at Nocton, you often hear the motorcyclists, particularly on a Sunday, go roaring along that particular stretch of road, ignoring the speed limit. And obviously, targeting the motorcyclists may help reduce other figures. Thank you.
It's not something that I've got available to me, but it is something that we are able to break down within the figures that we report. On this year's figures, I can say that motorcycle collisions are down on previous years, but that doesn't necessarily reflect in the antisocial use that you're reporting on the noise and the potential speed of other vehicles. But yes, we hold the data, but unfortunately it's not reported within this document.
Okay, Councillor Dunny.
Thank you, Mr. Chairman. I have a mystery for you here. I need to. But if you know Boston a little bit, you know we have a bridge street, which has come to Town Bridge, and then you go through the town to the John Adams Way, straight. You know, you go. So you start with 20 miles, and then it goes to 30 miles within 200 yards, and then it goes within 100 miles again to 20 miles. So people are getting confused. The speed in there is over 30 miles on a daily basis. You know, I contacted the police, and they say if we see someone, yes, we're going to stop them. If we don't, let it be. So it's then on the top of that, there's a lot of people there, you know, concerned about the speeding limits over there. There is a bump just by the Custom House building, which is nobody respect. People, they go over it, so they go on the pedestrian path to cross it. So as my colleague here, Councillor Kay said, it's probably narrowing the road there may make a change to this traffic. And also, you know, the signage itself, it doesn't make sense. You're going on 20, then it's 30, then it's 20. Probably 20 will be fine all the way to John Adams Way.
I can take it away and have a look at. Unfortunately, the Road Safety Partnership aren't responsible for the setting of speed limits, but I'll certainly have a look at the area and see whether we've got any traffic surveys within that area. And if not, then we can certainly have a look at what speeds people are doing.
It may also be as well to contact the TRO department, Councillor Dunny, as well, to let them look at it. Okay, thank you. No one else wishing to speak? Some key findings there are statistical neighbours, speed watch and KSIs regarding motorcyclists. So that's all been recorded and noted. The next service area is on page 51 to 54, which is volunteering. We've got Lee Surdyfield here, so again, take the report as read. Any questions for Lee, please? Councillor Key.
Yeah, I would just, Lee, just like to ask you what the County Council can actually add. What value do we add to the volunteering sector? because it's difficult sometimes for me to see where we fit in. Because I do a lot of volunteering and I know a lot of other people that do, but obviously it's not through the county council. So what do we add of value, do you think, to the volunteers? Thank you.
So we have
Okay,
a couple of bits. So through the contract with the VCS, based on the report you received last time at the committee, we support a framework across Lincolnshire for volunteer provision. That ensures that appropriate training is in place. It ensures that there's a hub for volunteering opportunities. But also as an organisation, we have a number of volunteering placements ourselves within our services. So within library services and various parts of heritage, and probably Will can add far more than me on that. But we have a whole set of volunteering placements that are supported through internal policy and through some of the work that the VCS provides. But Will, I don't know if you want to expand on some of the placements you have available.
Yeah, I'd be happy to. Volunteering, it's an incredibly important part of what we do, and there's two kind of faces to it. So on one side, volunteers, particularly in heritage, literally deliver a vital part of our service. So if you go to Lincoln Castle or you go to the Battle of Britain Memorial Flight Visitor Centre, the tours are delivered by volunteers, which is absolutely fantastic. So they have a very, very high quality engagement with the public. Volunteering is also a huge part of our library service. We've got the library annual report coming up next, but our community hub libraries are almost entirely run by volunteers, and one of the huge benefits to volunteers is not just actually, again, that they're delivering public services for our communities, but also that we are giving those volunteers skills, we're giving them confidence. So I think, to be honest, it's a win-win from absolutely every angle.
Yeah, I do agree. The whole county relies on volunteers, as the country does, and it's always been so, and it should be like that. I mean, people have so much to offer. So, yeah, I just wanted reassurance, because obviously we've got to be seen to be questioning every part of the council's work. So, thank you.
Okay, thank you. That's been recorded. Any further questions? No, so no further questions. So I'm going to thank you all for your questions and queries and comments, and also thank you to those that's answered the questions too. I'm going to move that the report be received and that performance indicators for public protection and communities as shown in Appendix A also are agreed. Can members please raise your hand if you agree? Thank you, that's carried, that's all agreed, thank you. We'll now move on to item 8, which is the performance of library service contract year 7. This item is on pages 61 to 76 of the agenda pack. The report provides us with an update on the performance of the library service contract delivered by Greenwich Leisure Limited. This is the year 7 review, and the information contained in this report is pertinent to the overall operations, key performance indicators, service transformation, innovation, community hubs operation, and performance. Before I go any further, I've got a point of correction. I think we've given Glenn Garrett the credit for this report, but the report has in fact been produced on behalf of Andy Gutherson, who's the Director of Place, rather than Glenn. The correction will be reflected in the meeting minutes. Our actions for today are as the committee is invited to consider and comment on the performance information, including the report. Secondly, consider and support the ongoing development and proposed Year 8 developments highlighted in the report. And thirdly, highlight any additional priorities for consideration. The report will be presented by Louise Egan, Library and Heritage Service Client Lead, Nicola Rogers, Partnership Manager at Greenwich Leisure Limited, who's also in attendance for this item. But firstly, over to you, Louise.
Thank you, Chair. So I won't go into the background of the service provision, as that is available within the report and Appendix A for your future reference. But in terms of Year 7, we have had a very productive and successful year across the library service. We've had a lot of activities and events that we've been held. We've had over 200 compliments, and we've also had the highest score across all of GLL partnerships in regards to satisfaction. So in terms of customer satisfaction of service, that they're delivered across numerous areas of service provision. We've also generated in the region of 24 million in regards to social value as per Appendix B, And in terms of Baroness Sanderson's visit across all of the county, she did highlight that one of Lincolnshire's libraries, and indeed one of the community hubs managed by the volunteers, was indeed her favourite library that she visited across all of England. Regarding performance, issues was above 4% from our current target and also 15% above the previous year, so showing that we are again increasing from that pandemic and kind of the COVID recovery. Splitting that out in 22-23, we were in the region of 1.5 million physical issues that were loaned and borrowed across all of the service, and around 500,000 digital issues again. So we can see that there is still growth in the physical issues and shows that the public appetite is still there for the physical books. That's not declining, it is still the preference, albeit we are seeing an increase in the amount of users using our digital services, and indeed e-audio increased by 58% in 22-23 compared to the previous year. Unfortunately, visits didn't achieve the target in Year 7. That is a national trend because we do continue to see our users and our customers attend less often, but they are borrowing the same amount of books as they previously did. However, whilst we didn't achieve the target, we were still 65% up on the previous year. So again, showing that slow and steady increase year on year from COVID and when some of our sites unfortunately had to close. So PN use, so this is the public network use, so the public computers for our customers, again didn't meet the target, but we were 95% on the previous year. But the reason that we didn't meet the target is because we have had significant infrastructure developments, and actually the public network machines work better than what they did do previously. So whilst we haven't achieved the target, it is actually a bit of a false negative because it's positive because customers are being able to do what they need to do a lot quicker and more efficiently. Service achievements include strong partnership working with refugees, successful implementation of the business bubble at 2 of our core sites, and also work with the National Data Bank Scheme, where GLL have been gifting data to those in need. And we've also launched the New Libraries Act, which has been very successful for the service and for customers alike. Community hubs are still progressing well. They're a valuable service to our local residents, and as pointed out earlier, we've got over 700 volunteers that manage those sites on our behalf, so they are fundamental to the service delivery, and they are supported through GLL, dedicating over 300 hours of training to them within Year 7. Looking forwards to Year 8, the focus is to keep increasing visits and performance and trying to get those targets where we didn't achieve them in Year 8 further to the targets for Year 7, further to the targets for Year 8, and also enhancing the business bubble offer and working with local businesses across all of our sites in the region. The new entrance at Boston has already been completed, so we've already got that in work and working nicely across the Boston site, and we will be working closely with the CSE over their initiatives and their enhancements that they're making across the service this year. Thank you, Chair.
Thank you. Do you have any questions? Councillor Mr. Clark.
Thank you for your report. Interesting reading. On page 63, congratulations, I think, are in order with the success of this reading challenge and the swimming vouchers. Could you tell us, please, what age group of the children? Are you talking 5 to 15, or does it span even bigger area? Thank you.
Thank you, Councillor. If I can pass it over to Nicola Rogers to provide more detail. Thank you.
Thank you. The Summer Reading Challenge we deliver in partnership with the Reading Agency. The core challenge is aimed at primary school children, so ages of 4 to 11. There is also what's known as a mini challenge, so preschoolers can complete that as well. So essentially you're looking from, well, little toddlers up to 11 for that. That said, we, if older children, 11, 12, 13, wish to take part in the Summer Reading Challenge, that's absolutely fine. So it's really your primary age children are the core target for the Summer Reading Challenge.
With it being such a success, I wasn't even aware of it. Next year, I presume we're going to continue with it. What extra publicity do you think we can get to make more people aware and to show the success of this? Because it's double-hatted. A, they're improving their reading, but also doing the swimming is like well-being and also safety. because you hear these horror stories of children unfortunately drowning. Thank you.
Sorry. The Summer Reading Challenge for this year is actually literally live now. It happens every year. It launched the 8th of July this year. It continues to the 9th of September. So it is one of our major promotions each year, and a lot of planning goes into. We contact all local schools and very much rely on schools, you know, promoting it through their avenues, through parent mail. They'll send out information. We will attend assemblies and class visits to promote it. We will again contact local summer activity groups to make them aware, as again it's something that they can be highlighting to children that attend through them, and just through our regular sessions. And so there's an awful lot in terms of us engaging with different organisations in the local community to promote it. Again, we promote at site. This year we have a dedicated web page where we've got that one point of information where people can go to find out you know, how to take part. And also, as part of the challenge, we do weekly activities during the summer holidays. So this year, at the core sites, there will be activities on various days for children to get involved in, again, to make them sort of motivated and want to take part, and as something fun and also free to do for families over the course of the summer.
If I may just add to that, Chair, we do also advertise it through GLL social media channels, and LCC social media channels re-promote the GLL ones just to advertise the Summer Reading Challenge. And likewise, a lot of our community hubs have their own social media pages, which they promote the sites themselves, the Summer Reading Challenges and the activities that they're doing within their own community hubs to try and reach people as well.
Okay, thank you. Councillor Mrs Clark.
Thank you, Chair. Thank you both for such an excellent report. It's really, really in-depth. I remember talking to you, Louise, last year about hubs, and I was looking into that, but for me that was just a bit too complicated for the area. But we've got Ermine, which is fairly close, and I know that a lot of people from the St Giles Division come across to that. The other thing I wanted to ask you about was the data bank scheme and the gifting of data, which is just remarkable. I mean, that is such a success. If you could just expand on that for us, please, and explain if that can be stretched across. I know it's going to food banks and things like that, but if that can be again stretched across to other services that we are hoping to provide or look into in the future. I'm thinking about women's centres, anywhere where people are dangerous, that sort of thing. So data gifting could be utilised in other areas so that we are seen to be helping a wider range of people in different circumstances. But if you could just expand on that and just give us a story behind that, I'd be really grateful. Thank you.
Thank you. Yeah, so I think firstly to say this is an initiative that GLL will manage to be successful with, and again just highlights the success of that partnership working between the local authority and our commissioned service provider. This is the first year that we have worked with those service providers to be able to do the data bank scheme, and I think it's something that's working really, really well so far across the core sites, and something that we're certainly interested in as kind of the commissioners and the service providers to see if it's something that we can initiate again next year, and maybe that's where we could look at expanding the reach of where it's available. I'll pass over again to Nicola to give a little bit more of the background, and if there is some joint working that we can do for those particular sites this year in advance of next year, we can certainly talk about that.
So the National Data Bank Scheme is being delivered through an organisation called the Good Things Foundation. So essentially we had to bid into them to be successful as one of their gifting partners. They themselves are working with the 3, O2 and Vodafone, who are obviously giving the vouchers. To be an official gifting site, we have to be what's known as an online centre with the Good Things Foundation. So that's sort of where that part goes through. The current scheme is due to end at the end of 2023. We don't know, though, if they are going to look at reprising that. We do, stats are sent in, are you with me, each month. You mentioned food banks, and that's something we have found is obviously people are also have other avenues, can get that. What we have done locally is we've contacted particularly our district councils, colleagues in the benefits offices, local charities as well that work on supporting people in the local community to help get the word out that we do have this scheme live and that we can do that. We are also on a daily basis, if we are encountering somebody who is perhaps coming in to use the computers and through the course of us helping them, we find out they are data poor, again, we can essentially self-refer and do that. So we're working with a number of different organisations to essentially point people to us. We wait to see what the Good Things Foundation want to do next year, but obviously if they are wanting to continue the scheme, we would be very happy to carry on.
Okay, thank you. I've got Councillor Mr Clark, followed by Councillor Sneath.
Thank you, Chairman. Referring to those data vouchers, do we actually know what the uptake has been over the sort of last 12 months? And then similarly, going on to the contract on Appendix A, there's no mention of the number of days or hours that the service has got to be provided each week, or have I missed that?
So the data bank actually launched in Lincolnshire in March. It was a scheme that we bid into literally. I sat between Christmas and New Year writing the bids. We found out we were successful in January and we launched locally in March, so it's only been going since then. We send our stats off nationally to the Good Things Foundation. I don't have the information in front of me at present, but I can certainly look to gather that and feedback through Louise.
And in terms of opening hours, apologies, yet that detail isn't included within the Appendix A. However, with the 15 core libraries, we've got 10 that we classify as Tier 1, which are around 48 to 45 hours a week per week that they are open each. And then we've got the other 5 Tier 2 libraries, which are closer to 20 hours that they are open per week. But I can give you the exact breakdown for every single site. 32 to 25 hours for the Tier 2, apologies. I can give you a full breakdown and email that over to you after the meeting if that would be useful.
No, it's all right. You don't have to give me the full breakdown. It was just I was inquisitive. I didn't know when you mentioned Tier 1 what the breakdown would be from that. Maybe if you put Tier 1 and then in a bracket 40 hours or whatever it is, that would give us an indication as to what would be expected for them to open.
Yep.
Thank you.
Thank you.
Okay, thank you. Councillor Sneath, then Councillor Key.
Thank you, Chair. This is fabulous. I used to work for the library service for several years, went round on a mobile library, not as a driver, but as the assistant. And we've moved on a lot, but I think that's what's so good about it. You're just moving with the times. You're not sticky in the mud. You know, for us readers, people who read a lot, you're still there. But for so many other people who aren't necessarily great readers, you're there offering so many other things, and it might lead them into reading. I hope it does. You know, this about having banks in there, that brings people in. The Warm Hubs brought people in last year, didn't it? Certainly in our village community hub, it brought so many people in. And a lot of those took books out, which was great. Coming from Spalding, we've obviously got a large population of people whose first language is English. Just wondered, do we offer, can they access books through us in their own languages? But all this is great, and I'm going to use a lot of it to promote through the channels I use to promote the work I do for the County Council, because there's just so much exciting stuff in there. I'm really impressed. Thank you very much. Thanks.
Thank you. That's lovely feedback to hear. And exactly what you've said, we are trying to ensure that we are keeping up with the trends. And I think through COVID and the pandemic, that was another area where GLL in particular and all of the community hubs could excel in keeping up what the demands of individuals needed, whether that be providing the click and collect when physical buildings weren't allowed to be open, or whether it was, as I say, the increase in the digital users that people had to by default go to because they couldn't get those books out. We do have a range of material in other languages, and I'll pass on to Nicola in case there's anything additional in regards to that.
Just in answer to your question about community languages, yes, we do offer stock in a range of community languages that we base very much on we look at demand, but also then we look at what community languages there are in the area. So for Spalding, for example, we do have upstairs on the first floor, we have a collection of community languages, Russian, Latvian, and so on. We have similar collections, particularly at Boston, Lincoln. We have Ukrainian now as well. We've been working on, particularly up at Louth, where we've done an awful lot of work with the East Lindsey area of sanctuaries. Getting hold of items in community languages can be challenging. So sometimes that does limit what we can provide. Where we can, we also, though, signpost to free digital resources. So, for example, for Ukrainian readers, with the refugees working with their host families, the main publishing city in Ukraine has been heavily bombed, so actually getting hold of hard copies books, while it's been done, it's been difficult. But there have been digital publishers that have provided, I think there's over 3,000 titles through one resource we've found that, again, we can refer people to. But yeah, we try to meet demands and also look at where people are wanting to improve their English. We also provide stock for what you might call emergent readers in English. There's a particular scheme called the Quick Read Scheme where they publish new titles each year, very much aimed at people improving their English and their reading, so that's available to people too.
Okay, thank you. Councillor Key.
Yes, thank you, Chairman. Just a question regarding, I'm from Heckington, by the way, and we've got a hub there. Just regarding the library development officers, could you give me a bit of information as to sort of how often you would visit the hub and what sort of practical help you're able to give them? Thank you.
Yep, so we've got 4 library development officers across the whole of Lincolnshire, and they're separated into how many hubs they've got depending on regions. And to be honest, it depends on how much the hub needs their support. So some might get them visiting once a week, some might be going near enough every day when they're setting up a new initiative. If any of the hubs get new volunteers, then the LDOs go out and ensure that that suite of training is delivered to those volunteers themselves, and they do proactively go out periodically throughout the year as well to refresh on that training. So that might be in regards to safeguarding, to GDPR, those kind of areas, but also operationally for how to use the library management system itself, to how to search for books, how to help with printing for customers. And it is very much the operational needs of that site. So we are quite flexible by nature for the community hubs, and we want them to be able to deliver schemes, projects, initiatives, events that each individual community needs. So if they can see themselves that there's a developing need for that community for a particular session, whether it be kind of colouring, whether it be focused on wellbeing, whether it be knit and natter, the LDOs will then be approached and go out to help set those groups up and give the support that they need, basically. So it's very tailored to each individual hub, and depending on what their requirements are.
Thank you. Councillor Danny.
Thank you, Mr. Chairman, and thank you for the report. I just have some few points to make. When I was young, I think, because we were 6 siblings, so we go for a holiday probably for a week, and then we used to have 2 months holiday in the summer. But it used to be activities in the library, so we used to go and read and play cards and play whatever you have, and that used to push us to go more often when we were out of school and during the school year. That was one of the points, if we do have that one, or create a system like that. The second thing, we know that we have food banks, and also we need food for our brains, and the food for our brains are the books. So you have to read more and more and more, so you get more information. So do we have any system, again, can we create some system which is food, probably book bank, where people can come and get the books and go, I have a small calf and I have a lot of books in it, and people, they come, believe you me, I'm shocked that people, they come and choose 3 books. Oh, Anton, can I take these and bring it back to you? Or they will change. So people, they are reading, and there is a lot of people interested in reading. The third thing, which is I want to touch on, is that we have a lot of elderly people in our, probably Lincolnshire in general, and a lot of them, they're not able to deal with the technology we have these days. So is there any way of having probably a segregated place for a certain kind of senior citizens to come and use a computer, whatever they need it for? And that will probably help them, because I think that will push them a little bit forward to, catch up with the technology. Thank you very much. Thank you, Mr. Chairman.
Thank you. So in regards to the activities and the events, I will pass over to Nicola to go into a little bit more detail shortly on that one. In regards to kind of the ageing population that we do have across Lincolnshire, we do have the mobile service. So we've got something called the access service. So for those that are have got either mobility issues or access issues, regardless of age, they are eligible and able to join that scheme. So that is literally books to their door, so that we don't have to worry about them not being able to access either a core site or a community hub. And in terms of the IT upskilling and support, we do buddy sessions. So there are dedicated sessions across all of our sites, core sites, and some of the community hubs deliver it depending on if there's the need in their particular area. So we do already do that of trying to help and promote IT and support. And that, again, that's not age specific. So we do have many different demographics across our communities in regards to some of our other sites in Boston, where it's more about help getting onto maybe job seekers because it's in English and that might not be the first language. The staff are all upskilled to be able to provide that support available as well. I'll pass over to Nicola to do the events and activities because we do quite a lot.
Thank you. So all of the core libraries, they have a programme of regular activities that happen weekly, fortnightly. All of the core libraries do at least 4 sessions per week for children. So there will be a story time, rhyme time, a Lego club, and some sort of usually crafting type offer. So that is happening each week alongside regular activities for adults. So this might be knit and natters, the IT taster sessions, writing groups, a wide variety of things. I think when we last counted, there was 100 and some, just over 100 and something, 100 and so activities per week happening across the 15 core libraries that people can get involved in. We obviously then, during the school holidays, have additional sessions. As I mentioned earlier, Summer Reading Challenge, there'll be an extra session each week for children, focusing on that. Plus we do sort of ad hoc as opportunities arrive, working with local authors, or for example, we have coming up in October National Libraries Week, we will look at working with the local community. The theme is green this year, so we're looking at working with an awful lot of environmental organisations to put on additional sessions for members of the public to find out and discover more and, as you said, feed their brain. In terms of IT support, as Louise said, yes, we already do taster sessions. We also offer Learn My Way, which is something that the Good Things Foundation deliver. So this is an online course where you can work through at your own pace, modules, learning the very basics from, mouse skills, etc., working up to online shopping. And again, staff are there for them to support. We also, in the last year, have done quite a lot of work with one of the LCC's learning department, one of their providers, Skills 365. They offer predominantly online courses, but what we've been doing is hosting them, providing in-person short sessions on a variety of IT and also numeracy courses as well. We also have things like quite often different adult ed providers might, if they're looking at promoting a certain course, will come in. We've had Grantham College doing drop-ins at Grantham Library, for example. We've also been working with the learning department to highlight their recent Multiply survey as well. So again, we're helping them contact different parts of the community that they might not otherwise reach to get feedback from them on the kind of support and courses they want as well. And again, we're very open to looking at what we can help deliver in a community setting, because we're very aware that if somebody does need to increase skills, a library can be seen as slightly less intimidating than perhaps going, are you with me, to an education institute, particularly if perhaps in their younger days they've had bad experiences. So that's something we can offer, that stepping stone to help people start that learning journey in a way that works for them.
Thank you. I can see no further questions. So I'm going to say that concludes the discussion of this item. So thank you to Louise and Nicola for your input there. Regarding the proposal, I've noted a few key findings there. One is the data bank scheme, community hubs, reading material in different languages, and the children and adult activities. That, along all the other things we discussed, are all been recorded. So I'm going to move that the report be endorsed, that the committee's satisfaction be recorded on activity undertaken in Year 7 of the contract, and ask that her comments and views in relation to priorities for Year 8 be shared with relevant officers and GLL partners for consideration. Can members please raise your hand if you agree? Thank you. That is agreed. We'll now move on to item 9, which is Trading Standards Enforcement and Education undertaken in respect of vapes 2022-2023. This item is on pages 77 to 88 of the agenda pack. The report outlines the work undertaken by Lincolnshire County Council Trading Standards during 2022-23 to tackle an increase in the availability of non-compliant disposable vapes and their sales to young people aged under 18. This topic was requested by members of this committee at the previous meeting. Our actions are the committee is invited to consider and comment on the contents of this report and the delivery of the enforcement and education measures in respect of vaping concerns undertaken by the Trading Standards Service in 2022-2023. Indeed, I note there was an article on Look North last night regarding vapes, and a head teacher had contacted the programme to tell them there was aware of a child aged 7 using vapes, so it's quite a hot topic at the moment. The report will be presented by Mark Keel, Head of Trading Standards, so without further ado, over to you, Mark.
Thank you, Mr. Chairman. So yes, this covers the work that Trading Standards have undertaken in 22-23. I'm not going to go into too much detail. The stats are there for people to read, and I'm quite happy to take questions on those. I would like to thank colleagues in public health for some input into the report, particularly around the messaging and sense checking what we were saying. And also to thank my colleague Daniel for attending today. He's the Tobacco Control Officer and produced the education part of the report, and he's here to take any questions on that particular aspect. So yeah, I'm quite happy to take questions.
Okay, any questions? Councillor Mr Clark, followed by Councillor Mrs Clark.
Thank you, Chairman.
I should have said ladies before gentlemen, really, but Mr Clark was first.
Yes, it's one of the few times I get to go first.
Go for it.
Page 84, it mentions about 50 workshops delivered in 3 months. That's approximately 4 per week. But could this be increased in view of the seriousness of this problem? Because, as reported on the television last night, a lot of parents are concerned, but then horrendously it was reported that some parents are buying the vapes for their children, which seems ludicrous, and whether we should, in our publicity, almost, vapes can kill, and have it in broad text and try and highlight the case, because that's what we used to do years ago, was saying about smoking tobacco. Thank you.
Well, there's 2 points on that. Firstly, in respect of the number of workshops that are delivered, the whole delivery of that programme is under review at the moment in Public Health, who actually fund Daniel's post. So we're waiting on the results of that review, and hopefully we'll have that after the summer. In terms of broad messaging, one of the things that Public Health, on advice of Public Health, is that we wouldn't publicise that vapes can kill, because it goes against the public health message. There's no evidence that vapes can kill at the moment, and in fact the message that we promote is that it is significantly better to vape than it is to smoke, because you're not inhaling things like tar that is produced by tobacco, by smoking tobacco. You're purely inhaling the nicotine as a vapour through the vape. I mean, there are caveats on that. It is we don't know what the longer term effect of that is, but the public health message at the moment is that vaping is much healthier for you than smoking. And if you do smoke, then you should consider vaping. If you don't smoke, then really there's no point in vaping. It's there. It was originally intended as a smoking cessation device, and wasn't the fashion accessory that it seems to have become today.
Yeah, going back to that point about not wanting to publicise it so much, if I'm correct, there was a report in the news of a young girl that had vaped excessively, and it messed up with her breathing, and she died from respiratory problems.
Okay, from my experience, what we've seen with some of those reports that have come through, we have to try and separate the issues of legal vapes and illegal vapes. A lot of these reports that we're getting about adverse effects from them are often linked to the illegality of vapes that are out there. These reports have highlighted people trying to put together their own e-liquid mixes and have had adverse effects to them. So that is really a separate issue to the legal sales of vapes that are out there, because we know what should be in legal vapes in terms of their size and their strengths and their safe manufacture. But you are right, some of the bad news stories do make the press around vapes, but a lot of those are totally illegal in terms of if it's a self-contained device or if it's the e-liquid itself. But I have actually worked with some of the schools where these pupils have been from, where they've had these adverse effects, and I've been invited in to present the more rounded issues on the relative safety of vapes, how they compare to smoking, and also addressing the laws and some of the unknowns, future health harms of vapes. So you're right, the conversations around vapes do tend to get a bit muddled, and we often only hear the negative side of it, which can often make people think that there really needs to be a clamp down on vapes. So like we say, there does need to be a review of what is true, what is false, and the information that we put out there.
Thanks for that, and hopefully you'll have more success in the schools and convince the youngsters not to vape. Thank you.
I certainly hope so, and your maths were correct around about 4 workshops a week, but that will often be the 4 schools a week, and in those schools there can be often several workshops that are delivered to different age groups, so I'm getting around them, yeah.
Okay, Councillor Mrs Clark.
Thank you, Chair. Thank you for the report and for indulging us both really on this. You deal with unsafe products, so my question is around that, and correctly that's what you're looking at. So the unsafe products, 19,132, of which 9,578 were non-compliant vapes. That's a lot, isn't it? And and I think because it's increasing in the news, I think because the vapes themselves and the worry around the vapes are the flavours of them, and they are attractive to younger people. Now, whether they're unsafe or not is your job to decide whether they're unsafe, and you're finding the unsafe ones, and thank you for that. That's brilliant work, and I know how hard you work, you know, you always bring a very full report about what you're finding, so I know there's loads out there. The thing that I'm concerned about as well is that the tie-in with this is that our teachers are saying this is not healthy. We're finding young children are doing this. They're vaping at school. They're going out at break. Some as young as 8, 9, 10-year-old, perhaps younger. Parents might be buying them for them. So there's a whole issue around the flavour of these things. And I note that on page 81 of the report, the Californian state legislators, they actually did pass a law banning flavoured vapes because they knew it was being targeted. And I think a lot of the tobacco companies, and you know, people have learnt that smoking is not healthy. So I think, my own personal view this is now, that this is the next kind of health issue that we're still collecting data on. We don't realise quite how dangerous and addictive it is, but it looks like it is in the future, and we need to really kind of keep an eye on it and monitor it far more closely, and that's going to mean more work for you and obviously more work in the schools, you know, and it's a resource thing. So for me, that's kind of building in that area, and I think we need to pay particular attention to it, really as a health issue and also as a safety issue. So really that's just my thoughts around that. I didn't know whether or not you wanted to add to that at all.
Well, in terms of flavours, again, you know, public health say that people who are giving up smoking quite like a flavoured compared to just the normal nicotine flavoured vape. So, but again, that is a legal product and a safe product, you know, that comes with the proper test certification. In terms of marketing, there are already rules under the Code of Advertising Practice around marketing. particularly aiming it at children and young people, and I think the code says that advertising shouldn't be aimed at people under the age of 25. You know, we've heard obviously the newspaper reports. All things are being considered at the moment, from outright bans to changing to plain packaging to make them less attractive, to considering moves on flavours and things like that as well. So for us, it's a watching brief. In terms of looking for the non-compliance, you know, it's not going to go away. So we're carrying on looking for those non-compliant products, and where we find them, we'll remove them from the market, as we have been doing. But there is it's not just a trading standards issue.
No.
And some of the things that you're referring to, certainly in the longer term health things, are a public health matter. But we're working very closely with them. We're very wary of giving out the right signals and trying to separate that illegal vape from the compliant product and the uses that they have. You know, we're very clear. You know, vape should not be sold to people under 18. People who are over 18 should not be buying products for people who are under 18 and commit proxy selling offences if they do. You know, but it's difficult to prove and difficult to replicate. So we'll carry on with our underage sales programme. We'll keep testing the marketplace. We'll keep putting the business advice out there. But yes, we're as concerned as anybody about the fact that these are falling into the hands of children.
Thank you.
Thank you. Councillor Danny, followed by Councillor Key.
Thank you, Mr. Chairman. Just some few points I would like to make. I mean, talking about the e-cigarettes and the public health. It's nothing sad than seeing young kids in the morning going to school, vaping and having this 39p energy drink, 8:30 in the morning, and some of them, they don't have breakfast. So, I totally understand that we are driven by corporations. And corporations, they're there to make money and profit. So at the moment, they will tell you, oh, there's nothing wrong with the vape because just nicotine, flavoring could be a danger, we're going to stop that. But this is all driven by money. It's the same thing happened probably in the 1920s or 1800s, 17th century, when people started smoking cigars and smoking cigarettes. It was no danger there. Everybody was having fun. Ladies, they were having these long cigarettes, you know, everything was good. Now we're paying the price. Around 4.6 million around the world today because of cigarettes every year. And then there is the same probably number or more people dying of alcohol. So there is no problem in that. It's always there's no problem. But I think the price will be paid in the future because the kids, you know, excessively having these e-cigarettes at the moment, they're going to have some complications in the future. And that's for sure, except if there is nothing wrong with that. So the second thing which is I would like to talk about as well is, you know, living in Boston, some of the off-license shops are open until midnight, and then they close, and then they open 5 o'clock in the morning, some of them 4:30 in the morning. So there is always this opportunity where you can buy an illegal product. And I know that a few of them, they have been closed, they have been shut because they were selling illegal products. So how can we fight these kind of behavior happening on daily basis in the towns where people, they are just frustrated? Last time a person went, bought a beer, come out, start fighting with people in the street and just causing the havoc because, oh, there's no police there, there's nobody to manage these things. So the illegal things are happening on daily basis. And in my, as a concerned resident of Boston and a councillor, it's probably not making me more happy or probably very optimistic for the future because at the moment, as I said, it's just sort of out of order. Thank you.
Okay, Mark. A number of questions there for you.
I think so, yeah. So, yes, we don't know what the long-term health impacts of vaping are, but as a trading standard service, all we can do is be led by the experts. So the public health messaging is what we follow. In terms of issues around Boston, you know, there are it's a partnership approach that has to be taken to antisocial behaviour or crime arising from illegal activity in a particular area. I do know that my colleague is working very closely with the neighbourhood policing team in Boston, as well as with the police alcohol licensing team as well. So there is enforcement action being taken there, and will continue to be led and work with our partners. In terms of what people can do to assist, it's always the reporting of matters through to either ourselves or to the police, depending on the nature of the incident, so that we have the best picture and the best intelligence there to devise the best response to it. So I would encourage anybody who's got concerns about vaping or where people are buying products from to report it to us, because it does inform future enforcement work.
Okay, thank you. Councillor Key.
Oh yes, thank you. Just a brief comment really, and that was just that I can see your conundrum with treading this fine line between the health benefits for smokers of vaping and our wish to stop children vaping. And children have always done things they shouldn't. I mean, I can remember when I was at school, it was smoking, and it was seen as being cool to smoke, and maybe that's our problem, that children or young people find vaping cool, and it's how we make it uncool. Because it does seem to be the volume and the amount of children doing it that is a lot more than perhaps were smoking, and I think that's the big problem. So it's something that I think everybody needs to address. Thank you.
Okay, thank you. Don't seem to have any more questions. What more can we do, Mark? What more can we do as a county council? How can we get this message over? County news, social media, what more can we do in your opinion?
I think there's certainly more work for us to do around educating business. We can certainly get more information out into the business community. And vapes are available in so many different places. You know, we've gone away from sort of traditional vaping shops that sold the component parts to make rechargeable vapes and had the variety of liquids in there to fill those. But this influx of disposable vapes, they're everywhere. There is not a particular type of shop that you can go into and expect to find them. You know, they're found in some really obscure places because they're readily available. So again, it's identifying those premises and getting that business advice across. And it's not just around spotting the non-compliant vapes, it's also that underage sales message as well. I think the test purchasing work that we do is important, and to publicise the results of that, because it makes people aware that we are out there checking and there are consequences for non-compliance. So again, it's making sure that we keep that work going. As far as the wider council goes, there's certainly public health messaging that needs to work with us, and I'm really pleased with the support that we get from them. And again, the messaging that they're putting out. Again, yes, things like county news is a good outlet, particularly for parents, but certainly looking at things like local press, local radio stations, that type of thing. Anywhere we can promote the message really around the use of vapes.
Okay, thank you. Councillor Danny.
It's just about making the public and the kids aware. I'm not sure if you do that or you already have done it, is having like posters in schools and explaining to them which one they're the wrong ones or the bad ones or the harmful ones from the ones which they are safe.
Okay, so just a little word of what I offer to schools. So the workshop that I offer, it's one that we call Vaping Have a Blast, and the word blast is an acronym looking at the different questions around vape. So we start with a question that people do want to know: are they bad for you? How do they compare to smoking? If you want to look at it as good news, the smoking rates in this country are the lowest they've been since they started doing records. Over the last 40 years or so, the adult prevalence and the youth prevalence is down to its lowest, but we do need to look at how they compare to cigarette smoking, and when they're described as less harmful, it's important that we use the right terminology for that. they shouldn't be described as like 95% safe. They are described as less harmful than cigarettes. And going back to that ladder analogy, that was quite a good one. You know, if you think there's 70,000 deaths in the UK each year as a result of smoking, well, if something is still a proportion less harmful than that, there will be some health harms associated with it. We look at the laws around vapes, the legal and the illegal ones. We look at, are they all the same? Are they safe to use? And then the T is, are they targeting young people? And another concern, could it be a trendy gateway into smoking? I deliver the workshops. If schools want to do further work around them, there are resources that they can freely have to borrow. I also have lesson plans, and they're welcome to keep the copy of the presentation for it. And I also then am a go-to to the school if they do have any issues or concerns about trends they're finding. They can report those back to me. I have encountered a range of vapes out there of various sizes and legality, and recently did actually encounter a vape which we suspect to be a cannabis vape as well. So they are out there, but we work with the schools to tackle it as best we can. But like we say, it is going to be reviewed as to how we can further educate and hopefully extend our offer.
Okay, thank you. I'm going to bring this to a close now. We've given that a fair airing. So thank you for your questions and comments. This now concludes the discussion of the item. And also thank you, Mark, and thank you, Daniel, for those questions you've been answering. Regarding the proposal, I'll just summarise some of the key points. That's the effects of nicotine, increased usage, the attraction and marketing, and potential future harm and reporting. A few key points there, but those, along with everything we said, has all been recorded. So I'm going to move that the report be received, that the committee's satisfaction be recorded on the delivery of the enforcement and education measures in respect of vaping concerns undertaken by the Trading Standards Service in 2022 and 2023, and I ask that further updates be shared with committee members through briefing updates or offline circulation in the coming months. Can members please raise your hand if you agree? Thank you, that's all agreed. Thank you. We'll now move on to item 10, which is the Public Protection and Community Scrutiny Committee Work Programme. This item is on pages 89 to 94 of the agenda pack. The report will be presented by Chiara. The actions of the committee we're invited to review the work programme and highlight any additional scrutiny activity which could be included for consideration in the work programme. Chiara, over to you to report.
Thank you very much, Mr. Chairman. The purpose for considering the work programme as a standing agenda item is to give members the opportunity to review the works already scheduled for the rest of the calendar year and beyond, and subsequently to propose amendments required in terms of either reprioritisation of items to be taken throughout this cycle, or to even request for further reports to be added in relation to areas of interest that always fall within the remit of this committee. It also gives officers opportunity to introduce any new topics that are anticipated to populate agendas in future months. And with this in mind, I would like to summarise the contents of the agenda that is due for our next meeting on the 19th of September. And these are the service level performance reporting against the Success Framework 2023-2024, and that is the Q1 report. We are due the Celebratory Services Annual Report. We do the outcomes of His Majesty's Inspectorate of Constabulary and Fire and Rescue Services inspection of Lincolnshire Fire and Rescue Service. We do the Community Risk Management Plan for 2024 to 2028, which is a pre-consultation item. And we do the Trading Standards Impact and Outcomes Framework, which is an annual report that this committee receives. Also, in terms of sitting as the Crime and Disorder Scrutiny Committee, we are due the Stay Safe Partnership Annual Update Report. I would also like to note that the title for item 1 of the October agenda is changing from Citizens Advice Lincolnshire Grant Funding Agreement to Commissioning and Citizens Advice, and this change will appear next time the work programme is going to be published. On the bottom of page 92, you will also find further information on items that will be programmed in future months and beyond in 2024. Any requests can be raised now or can be communicated to the Senior Scrutiny Officer Tracy Johnson, who is also in presence today, who will be responsible for this committee going forward, and this can be done either now or offline. And this concludes my update to you, and I'm happy to take any questions and comments, and I would like to also thank you for your very warm comments made at the beginning of this meeting. Thank you very much. It's been a pleasure.
Okay, thank you very much. Chiara, do you have any comments? Councillor Dunny.
Thank you, Mr. Chairman. Just go to item 5, Trading Standards Impacts and Outcomes Framework. I would like to see some breakdown of the figures, how many shops have been probably shut or been fined or things, just to know where we are. I mean, because our county is very big, so if we can have that figure, it may help us just to see where we are standing.
Okay, thank you. I'm going to turn to Martin for that one.
Yeah, we've got those figures. I was going to brief them in my performance, but we'll make sure they're written in. So very quickly, in terms of the visits, for the 22 premises we're visiting in Boston, 19 in Spalding, 12 in Gainsborough, 8 in Grantham, 2 in Louth, 5 in Lincoln. There were 15 closure orders issued out of that, 10 in Boston, 5 in Lincoln. And we eventually, with working with landlords, closed 18 premises, of which 8 were in Lincoln, 8 were in Boston, 1 in Bourne, 1 in Market Rasen.
Okay, thank you. Back to the work programme. Any questions? No. So for me, that concludes the discussion of the item. I'm going to move that we note the report and approve the existing work programme as detailed in pages 89 to 94. Can I ask you to raise your hand if you agree? Thank you. That's all agreed. Agenda item 11 is consideration of exempt information. Item 12 of the agenda requires the committee to consider exempt information. Therefore, I propose that in accordance with section 100A of the Local Government Act 1972, the press and public be excluded from the meeting for the following item of business on the grounds that if they were to be present, there could be a disclosure of exempt information as defined in paragraph 3 of part 1 of Schedule 12A of the Local Government Act 1972 as amended. The public interest in maintaining the exemption outweighs the public interest in disclosing the information because the report contains financial information relating to third parties, and the Council must be able to consider such information without thereby putting it in the public domain. May I have a proposer for this, please? Councillor Key. Seconder, Councillor Danny. Thank you. All those in favour, please raise your hand. No against, no abstention, so that is carried. What I'm going to do now is take a 5-minute comfort break, and only 5 minutes, and reconvene to an offline session. This will enable any online disconnections to be made. Just thank you to everyone for watching online for your attendance.